Hi, I'm Kacey Klein, and I'm here to give my speech about EMS and how it's changed over the years with the process of the schooling, the rides, and the ambulance operations. First of all, blood and guts is a gruesome sight, but for an EMT, paramedic, fireman, any kind of medic, it's like an adrenaline rush. There's different tricks and trades of the station, but they're not very hard. Once you go out and work, say for like Memphis Fire, they have their own way of setting up their units, when their calls, or how they basically operate. The different skills that you learn, that we learn in school, also helps on the field. To a certain extent, that's like an art. You have to know how to control the bleeding or stop the pain from a patient. In EMS, there's many steps to endure to become and live the lifestyle of an EMT. I'm currently attending school, and so are y'all, and I'm going to share these steps with you guys. There's 2 semesters, 80 hours on an ambulance. You have 6 12-hour shifts, and then there's the 1 ER time in the hospital. With the 2 semesters of school, they seem like they take forever, but once you get to the last month, like we are, it's flown by, for me at least. But with everything you learn from the very beginning, you have to learn all this stuff and remember it to pass the National Registry. The first semester is 7 hours. During the first semester, you learn the medical aspect of the field. You start learning different skills on how to assess a medical patient and like the clinicals for the National Registry. The second semester is an 8-hour class, and you learn the trauma aspect. You finish and master the skills of the bandaging, splints, shock, things like that to pass the National Registry. You can learn all these skills your own certain way after you get on the field that's easier and faster for you. You take your clinical rides. The first semester, you have 3 12-hour rides. For the most part, your first 3 rides, you're there to take vitals and observe your proctor and ask questions if you're curious on how to do things. You also start to learn how the ambulance operates, like when to do the lights and sirens, where everything is stored at in each individual bins of the ambulance. The second semester is a 3 12-hour ride, and you have the 1 ER time. During your second semester, you learn to do IVs, and you have to master your 5 IVs with 3 running fluids during your second semester. You get more patient contact and more hands-on experience. The more you take your rides, you talk to the patients, try to get their history and everything like that. You also need to know your ambulance front to back. If you don't know your ambulance front to back, when they say get something, you're like, well, where's that at? But you need to know how to do that. Each company you work for, Rural Metro is one, Medic one, Memphis Fire, they all have their way of doing things. The firehouse has different rules, the emergency room has different rules, but you need to learn all of them to understand what you're doing. Each company sets up a certain way for their access, for the easiest access in case of immediate need right then and there. Basically, in conclusion, my dream is to work for Memphis Fire, but I have to take baby steps. I'm almost finished with my second semester, and not much longer we'll be taking the National Registry, which is very, very difficult. I have done my best on all my clinicals. I have asked questions, and they have all told me if I ever wanted more practice, call the lieutenant, set up some more rides. For the most part, I know my ambulance inside and out. If they tell me to go get the back board, I know what door it's in. EMS, a lot of people see things that they freak out about, but like blood and guts, that can be gross to some, but it's just another day on the job for us. Thank you.
Very good.